Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And you know, I always tell you, the items that are brought to our attention all the time come from you. And it's either surgical techniques, particularly minimally invasive techniques you want to know about. It's always cancer, it's always cardiac disease, etc. And you know, I was very excited when I read about a new minimally invasive spinal surgical technique. I found out that, lo and behold, the individual that was doing it was right here in our community, Dr. Alexander Poisik. And he is a board-certified neurosurgeon, and he's a neurosurgical specialist here in South Florida at Westside Regional Hospital, which is just a stone's throw from this studio. So welcome, Doctor.
Thank you so much. It's great to be here.
Good to have you, sir. And one of my pride, one of our graduates, a PA, a physician assistant, AJ as they call her, but it's Aungelique. Baugus.
Yes.
Welcome, Aungelique. Welcome.
You. It's a pleasure.
Good to have you.
Thank you.
You haven't been on campus for a while.
I just graduated in August.
Oh, in August. So well, then you were right. You were right here. A stone's throw from this studio is where you walked across the stage.
I was showing Dr. Poisik where I went to school.
Yeah, right. Well, good. Good to have you.
Thank you.
We're very proud of our PA programs, and we're very proud of the fact that now you're with Dr. Poisik.
I'm so proud
How about
to be
that?
with him.
I want to mention how well trained AJ, Aungelique, is, and she hit the ground running when she started working with us.
Good. Well, Dr. Poisik, again, like I tell you, you know, interestingly, the audience, and this program has been driven for the last 16 years, almost 17 years, by the audience. They want to know about something. And one of the things that, as a constant query from them, is on surgical techniques, because when they think of surgery, they think of a lot of cutting, a lot of blood, a lot of pain. And this is so obviated by the fact that, or I should say, your presentation will tell them why they should not feel that way about your techniques and surgery. So tell us what the minimally invasive spinal surgical technique that you do.
Absolutely. I wanted to mention that I don't blame people for having this impression of spine surgery, because over many, many years, the reputation for spine surgery has been created by large, painful surgeries with mixed outcomes. However, in the last, I would say, 10 years, the new techniques came to light, and we're able to do them right here at Westside Regional Hospital, which involve much smaller incisions, essentially minimal blood loss, and great outcomes, which have been facilitated by newer techniques and also by new robotic technology. Westside Hospital has invested in very new technology involving robotic guidance for spine surgery, which helps me perform surgical procedures with exactness and minimally traumatic approaches, and to decrease the exposure to radiation in surgery as well. That's another aspect of this that nobody has paid too much attention until recently. Newer techniques in neurosurgery and spine surgery involve performing of intraoperative CAT scans, which expose patients to very large doses of ionizing radiation, which increases the risk of cancer when it's high enough. With this technique and robotic guidance, all we have to do is a simple CAT scan of the lumbar spine or part of the spine that we're operating on prior to surgery, and then in surgery, all we have to do is 2 or 3 simple x-rays. And we can perform the surgery in a very exact fashion.
I understand that there's a 3D dimension to your I guess you could say your scanning. Is that true?
The computer does the 3D reconstruction of the simple CAT scan
Right.
with digital processing. That's all it is.
And in the robotic nature of the procedure, the imagery is 3D as well?
It is 3D, and robot helps me with precision guidance. This is it's not a robot that is used for prostate surgery, for example, where I sit in front of a screen and have several monitors and handles that I manipulate the robot. This is different. This robot helps me guide the screws into the spine in the exact fashion to avoid the nerves, the spinal cord, etc.
So people always ask about robotic surgery relative. They say, well, you know, why am I getting a doctor who's not using his hands? The truth is, you are using your hands.
Absolutely.
It's a technique.
Absolutely.
Correct?
Correct. I am using my hands. I do everything under microscope for precision purposes, and robot just helps me guide the screws that are placed into patients' spines in a very precise fashion.
Okay, well, Aungelique, tell us about your involvement with Dr. Poisik and also just being there at Westside Regional. What's new there? What's going on?
Well, I'm new there. I just started last week with Dr. Poisik. So we did 4 surgeries yesterday, and it was my first time being in the OR with him. So I'm a little bit new to the neurosurgery specialty, but he's teaching me so much, and it's been a great opportunity.
But as a student during your clinical rotations,
Right.
you went through multiple different, shall we say, venues of healthcare, correct?
Yes.
Whether it be dermatology, whether it be surgery,
Right.
et cetera. Is that correct?
Yes, I did my elective rotation in trauma surgery, and I did another elective in orthopedic surgery so I could get my foot in the door with surgery.
So
and I loved it.
Dr. Poisik, I don't know whether you know it, but you know, we have some of the pioneers in the field of physician assistants that started our program.
Absolutely.
People that came out of the military. They were very interesting in that they decided to be affiliated and associated with the physician because they work under the scope of the physician's license. And yet they are so valuable, I believe. And I'm not saying this because you're sitting here, Aungelique.
No, absolutely. I just want to tell you from my standpoint, I trained at Columbia University in New York City and Emory University in Atlanta, Georgia, and I work with PAs coming from all kinds of different schools. And working with AJ, I've been really pleasantly impressed with the level of the training at Nova PA program.
Well, it makes my heart patter that Nova Southeastern University did for you what I hope that we did for Aungelique and all the other students that are throughout the nation. By the way, just to mention it, you and I have the same alma mater because I went to Columbia University as well. So there we are.
It's an honor to be here.
Yeah, thank you. Let me talk to you about the procedure itself. Why don't we get into some detail for the folks to mitigate their anxiety over, like I said, cutting blood, pain. There you are.
As you know, the back pain is a major contributor to disability in the United States. Most people in their lifetime will have back pain of some sort. Fortunately, only a small percentage of these patients will ever require surgery. Most of the back issues resolve on their own or with physical therapy or with injections of various kinds. And when people come to our office, we try to manage them conservatively, if possible, for at least 3 months. Only those people who do not respond to conservative treatment end up benefiting from surgery. Before we ever talk about surgery, we discuss any possible intervention that would be helpful prior to surgery. When the people are ready to have surgery, we discuss the risks and benefits of the procedure. These days, surgery can be done on an outpatient basis. As a matter of fact, more than half of my surgeries that I perform are done on an outpatient basis. They go home 2 or 3 hours after the surgery. When they have to stay in the hospital, the surgical procedure takes anywhere between 1 to 2 hours, sometimes 3 in especially complicated cases. People are completely asleep for the procedure. When they wake up, they already have pain medication on board, so it's a gentle wake up from surgery. Physical therapist gets them up the same afternoon of the surgery to minimize the complications of surgery. And even with complicated surgeries and people needing to stay in a hospital, typically they're able to go home on post-op day 1 or 2.
I became a victim of some spinal issues which had to be evaluated and surgerized. And what Dr. Poisik is saying is the people that you see in the OR standing alongside Dr. Poisik and aiding him are the people who are not much like myself. How do you feel when you see Dr. Poisik doing what he does and you assisting him in the manner in which you do, and the value of the patient who comes back afterwards wanting to hug and kiss both of you? How does it feel?
I mean, it's just amazing. I'm in awe of the surgery and watching him do his work, and I'm so blessed that I can be in this operating room and see what's being done. And it's amazing when the patient does come back, and whether they had weakness or paralysis or something before the surgery, and they come back and a few weeks later and they're doing so much better, or they're talking, or so much improvement. It's amazing to see.
Another aspect of my practice is people who've had surgery by other physicians and may not have had as successful result as they would have hoped for. I also specialize in difficult revision surgeries, which have been helping people, even though they failed their first or second surgery. A different approach may be helpful to relieve their symptoms, often.
Do you, and we also have a lot of folks that pose questions to us about, they don't realize that it emanates from the spine. You get these incredulous spasms, you know, in the right leg, the left leg, you know.
Even in the shoulder or arm, sometimes they're confused for a chest pain from heart problems.
That's correct. They believe, they go running to the cardiologist, correctly so. Because I'm a firm believer, I always tell our viewers, you know, don't hide your problems. Get to your doctor. Don't be afraid. Tell them everything that you want to tell them. No matter what it is, let them know. Let them make the decisions for you. You don't make your own decisions. I always tell our viewers that. So you anticipated some of my comments for later on in the broadcast, but there you are. I mean, people need to know that there are obvious reasons why, and you know, in your field of neurologic surgical techniques has changed so dramatically over the last 10 years. True?
Yes, absolutely. And with new microsurgical techniques, we're able to remove brain tumors in a much more efficient fashion. We have new microscopes that allow us to visualize things much clearer and crisper, which is better for patients' outcomes and surgeons' eyes. We're doing navigation in surgery with robot and non-robot navigation, which helps us do the surgery safer, both in the brain and the spine. So absolutely.
You just went into an area that brings great interest to me from a personal perspective. Not me, Fred, but myself, but from a family perspective. Because we've had a number of folks that have had diagnosed, I guess you could say, aneurysm potentials.
Yes.
I assume that you also go in talking about brain surgery, that's also a technique to repair. Is that correct?
That's one of the techniques to repair aneurysms. I do not do aneurysm repair at Westside Regional Hospital, but we have several interventional neuroradiologists who repair aneurysms by a minimally invasive technique through a catheter.
Yeah, so I understand. I was just reading some things from from Mount Sinai Hospital up in New York.
Yes.
They have a very large neurosurgical team there.
Absolutely.
And
One of them is a friend of mine.
Really?
We trained at Columbia together.
That's very good. You can say his name if you like.
His name is Jay Mako.
Okay. So J. Mako High in New York.
Yes.
But I would say to you that it's very interesting because these techniques are not limited to, even though you're subspecialty, you're a neurologic surgical specialist that tends to do spines and I guess you could say some brain issues. But there are other repair entities that cross over into your area.
Another thing that you wouldn't expect neurosurgeon to do, and we do here at Westside Regional Hospital, is peripheral nerve surgery, carpal tunnel release surgery, and ulnar nerve decompression surgery, which are typically associated maybe with orthopedics or plastic surgery, but I am well trained in performing those.
That's interesting.
And that's also minimally invasive surgery, same-day surgery, non-painful surgery.
Because there's a lot of people that write to us about carpal tunnel syndrome.
Absolutely.
And
it's very common.
It is very common. Is it common because of the nature of us sitting in front of a computer all day long, or is it?
That's only one aspect of it. The primary reason is the median nerve lives in your wrist,
right,
surrounded by very hard structures on all sides. It's
right,
surrounded by bones
right,
of the hand, and on one aspect, on the ventral aspect,
right,
it's surrounded by a ligament, which with overuse or with certain medical conditions can overgrow, become too big. And median nerve has nowhere to hide. It's surrounded by bones and this ligament, so if the ligament gets too thick, the median nerve gets compressed chronically and creates chronic pain, weakness, and numbness in the hand.
Dr. Poisik, let me get back again, just because I want to talk a bit about the brain issues. There are a lot of people that end up with, I guess you can say, tumor-like or tumor-processed elements in the brain, and I assume that the technique is very similar to what you do on the spine.
It's similar, but it's completely, in a way, it's completely different.
I understand.
We do all aspects of brain surgery at Westside Regional Hospital. We have the latest and the greatest equipment to perform it. I enjoy removing brain tumors from people's brains. There are several approaches that we utilize. We are able to go through the front of the head, back of the head, and also through the nose to the pituitary gland. That pretty much covers 99.9% of the tumors that can happen in people's brains. We have excellent outcomes after brain tumor surgery. Brain tumor surgery is not as painful as it used to be. People after a simple pituitary surgery can go home 1 or 2 days after the surgery. Like I said, complication rates are near zero. And we're proud of our outcomes.
And I understand also from in not only in knowledge of what you just said, but also in some of my readings, I have a tendency to want to read. I guess it's my Columbia University training, right?
They trained you well.
They trained you well. Everybody always said in the beginning, you know, those first 4 years, why do we take so many courses in liberal arts? Well, it really taught you how to be a critical thinker, I think.
Absolutely.
But the fact is that this type of surgical procedure is, again, minimally invasive, but it's dramatically life-saving.
Absolutely, and AJ has seen many of my patients who came from the brink of death to being normal again after surgery. And I have a great supporting staff in the hospital, in the operating room, and in the intensive care unit. We have great specialists who help us take care of patients before and after the surgery. And like I said, latest generation equipment like microscopes and brain navigation systems that allow me to target the brain in a very precise fashion.
And I'm being a little bit presumptive, but I'm going to be, and that is that without the loss of what I would call brain activity, cognitive activity, correct?
Absolutely, absolutely.
Right.
We know how to avoid brain damage in surgery.
Well, that's what I'm saying. Yeah. Yes. It's remarkable. We're down to the last 2 minutes of this show. We've been I've been receiving a lot of information from you. Aungelique, I'm going to let you start out.
I mean, Nova was an amazing experience. The professors were incredible. And without my friends, too, everyone going through the same thing at the same time, being in the same boat together, we helped each other, you know, get through the brutal 2 years of all of this learning into your brain at once. It's like drinking out of a fire hydrant, they say. But without the teachers and professors at Nova, I wouldn't be with Dr. Poisik today. If I went to a different school, I don't think I would be a neurosurgery PA with Dr. Poisik.
Dr. Poisik?
I just wanted to mention that HCA system is building a brand new hospital right next door here.
That's right.
And my understanding is that my neurosurgical practice is going to be based there. Yep. And I look forward to building nice teaching program there for medical students and for PA students once the time comes.
Oh, well, the time is approaching. They're pouring concrete and drilling into the ground and banging away. So, you know, we're very excited about it. And I would hope that the style of individuals like yourself are there not only for the student population and the training, but to tell you the truth, the public needs good health care. And the public is seeking good health care. And the public wants to know about new techniques and less pain and less debilitation. They want to receive the best, and you're the best. So
thank you.
Thank you very much. Folks, I hope we answered some of your questions. And if you didn't answer your questions, there's a telephone number and an email address right here. Just send it ahead. And Dr. Poisik, where is your office now?
My main office is right next to Westside Regional Hospital.
In a medical office building, right next to it.
In a medical office building. Right. And we're about to open a new office at Northwest Medical Center as well. Okay,
all right. So if you need to reach Dr. Poisik, all you do is look it up. We'll put a telephone number and address down. And remember, as I always say to you, you got to take good care of yourself. And the way you take good care of yourself is don't let things go by. You know, I'm not telling you have to run to the doctor every day, but, you know, get your annual checkups, get your semi-annual checkups, whatever is certified to you by your physician, particularly your primary care physicians. And I'm talking about men and women too. You know, we do have some people that think that we never got to the weekend warriors, but we'll talk about that another time. But the thing is that you got to take care of yourself, and please don't hide things from your physicians. Let them know what over-the-counter preparations you're taking, what vitamins, supplements, nutraceuticals, whatever, because it makes their life a lot easier. It gives them the opportunity to help you with a more complete and knowledge. So once again, Aungelique Baugus, thank you very much. We're very proud of you. And Dr. Alexander Poisik, thank you very much, my fellow classmate. Not my classmate, but whatever, alumna, how about that? I'm much older than you are. And I'm who's a board-certified neurosurgeon at Westside Regional Hospital. And we thank you, folks. Remember, this program is called Dateline Health. We come to you from Nova Southeastern University. And until next time, my name is Fred Lippman. See ya.